Good morning to one and all. I am Dr. Tariq, Diploma in Biotechnology, Islamia College. The first BSc Biotechnology allied subject. So we continue to the topic is vitamin D. So we discuss about in biomolecules subject vitamin D in detail. Actually, the vitamin D is a fat soluble vitamin, and vitamin D is a steroid. It contains steroid nucleus. Vitamin D, its function like hormone. Its forms diet occurs two forms D2 and D3. Ergo calciferol, and another one is vitamin D3 cholecalciferol. Vitamin D, it's joined together, it's a bone deficiency problem. So its main key are lock and key systems. Vitamin D. The vitamin D is like a key that unlocks the door and lets calcium into the body. Cholecalciferol vitamin D is found in animals. Both sterols are similar in structure, except that ergocalciferol has an additional methyl group and double bond structure. Ergocalciferol and cholecalciferol, the two major things, vitamin D2 and D3, are the sources for vitamin D activity and are referred as provitamins. Actually, the vitamin D is synthesized in the sunlight. You have to straight away to observe the sunlight in the early morning as well as the evening sunset time. So your sunlight is giving to your skin, turns cholesterol into vitamin D. What is the major synthesis structures? And vitamin D is a sunshine during the courses of cholesterol biosynthesis. A dehydrocholesterol is formed as an intermediate. When they are exposed to sunlight, it is converted into cholecalciferol in the skin. That means the dermatitis. The dark skin pigments melanin adversely influences the synthesis of cholecalciferol. The major role of the skin is the largest organ in our body. The production of vitamin D in the skin is directly proportional to the exposure to sunlight and inversely proportional to the pigmentation of skin. Actually, the excessive exposure of sunlight does not result in vitamin D toxicity, since excess provitamin D3 are destroyed by sunlight itself. Actually, the mechanism that sunlight through the skin, then 7-dehydrocholesterol, the cholecalciferol with D3, It's observe the liver, that means dietary intake, fish, meat, and some other supplements. Then liver will be developed. After that, 25 hydroxy vitamin D3, that means the kidney, the organ. 1 to 25 dehydroxy vitamin D3, that means cholecalciferol. They maintain the calcium balance in our body. Actually, the absorption of the vitamin D3, it's direct from animal sources such as animal liver contain the vitamin D3. Diet from plant sources contain vitamin D2. That is the absorption of vitamin D3 and D2 are absorbed from upper small intestine and bile. Bile is essential. Actually, the mechanism of vitamin D3 and D2 form the mixed micelles by combining with bile salts, that means micelles. Mixed micelles are presented to mucosal cells, that means the absorption occurs by positive transport system. Most of the Mediterranean countries, it directly comes under the sunlight than the western, that means European and Arctic regions. Peoples is so many deficiency of vitamin D. The recently publicity on melanoma has reduced our sun exposure. So we are getting less vitamin D. Actually, the vitamin D transport system is binding the globulin. It's transport from intestine to the liver by binding to vitamin D binding globulin. The storage of vitamin D is 25 hydroxychlorocalciferol is the major storage and circulatory form of vitamin D. Actually, the rickets is the one of the major deficiency of the kids. So many problems, delayed closures of frontiers, so many difficulties in the kids' deficiency of the rickets. The metabolism and biochemical functions. Actually, its synthesis is the 125 dehydroxychlorocalciferol. The active forms of the vitamin D is so called is calcitriol. The kidney possesses the specific enzyme also is there. Some of the vitamin D deficiencies are there. The deficiency of vitamin D causes rickets in children and osteomalacia. It's adult. And another deficiency is rickets. It is a vitamin deficiency state in children. Causes dietary deficiency and non-exposure to sunlight. Number 1. In modern culture, in civilization, so many people does not take awaken in the early morning. So many adulthood age also the deficiency of vitamin D rickets. It is a children is characterized by bone deformities due to incomplete mineralization. Osteomalacia. Vitamin D deficiency in adults also. It's caused inadequate exposure to sunlight or low dietary intake. In futures, Demineralization occurs mainly in spine, pelvis, and lower extremities. Sometimes the bowing of the long bones may occur due to weight of the body. Flattening of pelvis bones may cause difficulty during the labor time. Some causes of enlargement and softening the bones. It is highly dangerous. We cannot standing alone because of softening of the backbone of this calcium deficiency. Delay the teeth formation, weight bearing bones, bend bowlegs, decreased serum calcium, deformation of muscles in these findings biochemical aspect, decreased serum calcium 9 to 11 milligram per dilution, decrease the plasma phosphorus, which is 3 to 4.5 milligram per dilution. Increased plasma alkaline phosphatase 30 to 130 in ounce. Osteoporosis is a major disease of the adulthood age because of lack of sunlight exposure. Disease in which bones lose minerals and bone density, bones increase, it become a thin, fragile and easily broke down. It's normal bone structure in this left side and osteoporotic bone is right side. The picture shows that osteoporosis disease. Actually, one of the older woman is deficient, but it's totally different. In osteoporosis can occur at any age and any time. Vitamin D toxicity. Vitamin D is stored mainly in liver, number one, and most toxic in overdoses, number two. Toxic effects include deterioration of bones and increased calcium absorption from intestine leading increased plasma calcium. Hypercalcemia is associated with the deposition of calcium in many soft tissues such as kidney and arteries. It leads to formation of stones, renal calculi. High consumption is associated with the loss of appetite, nausea, increased thirst, loss of weight. Vitamin D essential for our immune system also. When foreign material protein enter into our body, helper to T cells turn into killer T cells. So helper T cells going to the helping the killing the protein, that means foreign material. An army of specific killer cells attack and kill them. So that most important, the vitamin D is also our immune system for more essential. Without vitamin D, the white cells lie dormant. The helper T cells most powerful. The killer cells is using that. So vitamin D is the most essential. How much vitamin D should we take? So depends upon the age group. In infant, by birth to 6 months, the recommended to dietary allowance of per day micrograms, 10 micrograms. So infant stages 7 to 12 months, 10 microgram. Children 1 to 3, 15, and the children 4 to 8 years. So children and adult up to 70 years, that means 9 age to 70 years onwards, 50 microgram. Some cancers can raise blood calcium level, so in cancer patient ask for calcium level to be checked before starting and after being on high dose of vitamin D. So vitamin D is available, comes under the sunlight and almond, groundnut, pista and pulses, some of the dried nuts also, some of the vegetable fruits also available, avocado and some of the milkshakes and strawberry, broccoli, etc. So cod liver oil, that means a fish, cheese, also available in vitamin D. So types of vitamin D supplementation. Do you know vitamin D2? It's ergocalciferol, or vitamin D3, it's a calcitriol. So that the adult treated vitamin D, recent meta-analysis indicated the vitamin D3. So that the main sources of vitamin types is supplemented. So that finally we conclude low vitamin D levels associated with the Parkinson disease and some of the allergic like asthmatic disease and diabetes and cancer, a connect or disconnect disease, stroke, prevent, treat and beat. We can tolerate in low number of vitamin D levels. So that kinds of disease will present in the future. Some of the list illnesses of benefiting from vitamin D grows by the day. So that cancer, hypertension, heart disease, autism, obesity, rheumatoid arthritis, diabetes 1 and 2, multiple sclerosis, Crohn's disease, flu, cold, tuberculosis, septicemia, aging, psoriasis, eczema, insomnia, hearing loss, muscle pain, cavities, periodontal disease, or athletic performance, macular degenerations, myopia, preeclampsia, seizures, fertility also, asthma, and cystic fibrosis, migraines, depressions, Alzheimer's disease, and schizophrenia. So many diseases, the list of illnesses benefiting from vitamin D grows by the day. So that I conclude, so many diseases, vitamin D deficiency problem, major role of immunity will be increased. So many diseases comes under this deficiency of vitamin D. So we can improve and expose the sunlight in every day. Very good health and a good life. Thanks to watching. Thanks one and all.